Hello, good afternoon. My name is Michael. I'm going to be your nurse today. What is your name and your date of birth?
Ashley, 12/10/87.
Okay, perfect. I'm going to look at your orders. It looks like the doctor ordered a head to toe assessment. Is that okay with you?
Yes, that's fine.
All right, perfect. I'm just going to do some hand hygiene and provide you with some privacy. All right. And so, can you tell me who the president is?
Yes, it's Joe Biden.
All right, perfect. And what month are we in?
We're in March.
Okay. And where are you at right now?
I'm at home
Okay. And why are you here today?
for the head to toe assessment.
All right, perfect. So patient is alert and oriented ×4 to person, place, time, and situation. All right. And if it's okay, I'm going to start just with your head, and I'm going to inspect your scalp. If it's okay for me to put my hands on you.
Yes, that's fine.
Okay. All right. So I'm just palpating patient's scalp, feeling for any bumps or lesions. All right. Patient looks well groomed. Looks like they take care of themselves and dressed appropriately for the weather today. Head is symmetrical and round. And I'm just going to check your eyes. All right. Just going to check the diameter of your pupils. All right, pupils are 5 millimeters, and pupils are round and equal. And I'm just going to check the pupils if they react to light. Pupils react to light bilaterally. And then I'm going to do what's called an accommodation. So I just need you, if you could look up at the fan, okay, and go ahead and look at this pen. Okay. So pupils, when she looks up close, they constrict, and when she looks away or at a distance, they dilate. So that looks good. All right. I'm just going to check your ears. Ears are, let's see, ears are symmetrical. Have you had any headaches recently? Or any ear pain?
No.
All right. Any problems seeing? Blurry vision? Okay. What about any nosebleeds?
No.
Okay. We're going to check what's called patency. Just want to make sure that you can breathe through each nostril. So if you could take your finger and just close one nostril and breathe out the other. Okay. And can you do the other side? All right. Perfect. So nerves are patent. I'm just going to look up your nose, just make sure they're pink and moist. And can you open your mouth? I'm just checking for dryness. Make sure she's not dehydrated. Oral mucosa is pink and moist. Dentition, the gums are tight around her teeth. And any cavities or bridges or caps or anything on your teeth?
There might be some caps from a while ago.
Okay, perfect. I'll just notate that. Okay, perfect. Now, if you could turn to the right or to the left, your left, and then to your right. All right. So neck structure looks good. She can rotate her head. And I'm just gonna check for if you could look that way. I'm gonna check for jugular vein distension. This is actually in the cardiac assessment, but since I'm at the neck, I'm gonna have to check it. And go ahead and turn back towards me. Perfect. So no signs of JVD. Any sore throats?
No.
Okay. Trachea is midline. And can you go ahead? Any problem swallowing?
No.
All right. Can you go ahead and swallow for me? All right. Patient can swallow. No issues with speech. Patient is talking to me. And she follows me around with her eyes, so no problems with vision as I can see. Um, and her pigmentation is according to um, her nationality. And I'm just gonna go ahead and pull up your sleeves. I'm gonna feel both sides of your skin. Make sure. So skin is bilaterally the same temperature, same color. I'm gonna look at. Actually, I'm gonna check for skin figure. I'm just gonna pull your shirt down just below your clavicle, if that's okay.
Mhm.
Then just gonna check for dehydration. There's no skin turgor, means that you're dehydrated. Um, and then I'm gonna check for capillary refill. All right, cap refill is 2 seconds. And then her nails, there's no clubbing. They are perfect. They are nice and groomed and round. All right. And okay. So next I'm going to do your cardiac assessment.
Okay.
I'm just going to listen to your heart, and then I'll move on to your respiratory assessment as well, since we're in the same area.
Okay.
All right. All right. And I'm just going to feel for your clavicle. I'm just going to go down one intercostal space. And I'm going to listen to, this is your aortic valve. I'm going to move over your sternum to stay in the second intercostal space and listen to your pulmonic valve. And I'm going to go right down to your third intercostal space and listen to the Erb's point. And then if you could just displace your breast. Yeah, perfect. I'm down in the fourth intercostal space and listening to the tricuspid valve. And then I'm moving down underneath the breast, midline clavicular, and listening to the apex or the apical pulse. If I could not get pulses, or if I got irregular pulses, I would listen for 1 minute here. And this is where your PMI is. All right, perfect. Now I'm going to listen to your lungs as well, since I'm right here.
Okay.
All right, and I'm in her right upper lobe. Perfect. Thank you for breathing. Then I'm in her left upper lobe. I'm just going to come down, and I'll be in her left. I'm still in her left upper lobe. And then I'm moving over here to the right middle lobe. And then can you bring this arm over across your chest? And I'll listen to, this will be your right lower lobe. Breathing. And can you, yep, same. And now I'm in her left lower lobe. All right, perfect. Now can you move forward? All right, so I'm gonna be in her right upper lobe. Move over to her left upper lobe. Down over her scapula to her left lower lobe. Then over to her right lower lobe. All right, perfect. All right, you can sit back. And if I wanted to listen to any, and I was listening for S1 and S2 sounds in your heart, I could, if you were pregnant, possibly hear S3 with the diaphragm.
Mm-hmm.
But if I turn this and listen through my bell, I would listen for any murmurs or any heart dysrhythmias.
Mm-hmm.
And I'm actually going to listen right here for to make sure you don't have what's called a AAA. Is a aortic aortic aneurysm.
Mhm.
And this is actually part of your GI assessment. I'm just listening since I have my stethoscope. All right. All right, now I'm going to go into your GI system and I'm going to listen to your bowel sounds. So go ahead and just put your arms right there. All right, I'm in your right lower quadrant. All right. And if I want to hear any vascular sounds, I will listen for a full minute in each quadrant. Now we'll move up to your right upper quadrant, your left upper quadrant, and then your left lower quadrant. All right. Now I'm gonna go ahead and lightly palpate. Any tenderness there?
No.
Any tenderness there?
No.
Any tenderness there?
Mhm.
Any tenderness there? All right. And then, all right, perfect. When was your last bowel movement?
I think yesterday.
Okay. All right, perfect. And any problems with flatulation or passing gas?
Not a problem with it.
Okay, perfect. And any problems urinating?
No.
Okay. And any, what color is your urine?
Usually yellow.
Yellow. Okay. And any burning sensation or anything while you urinate?
No.
Okay. Any trouble breathing or any heart or any trouble breathing or any chest pain?
No.
Okay, perfect. All right. And I just want to educate you on a couple things with the respiratory system. Now, do you have any cough or sputum from your cough that comes up? Okay. Now, I just want to educate you on what's called a turn, cough, and deep breathe.
Okay.
Let's actually turn, deep breathe, and cough, and then incentive spirometer. So I'm going to give you this as an incentive spirometer. And what you would do is you would just take a deep breath in, hold it for a couple seconds, and then breathe into it. And you would go to this line right here.
Okay.
And you will do this 10 times an hour while you're asleep.
Okay.
Okay. So pretty much it's like every 10 minutes
Mhm.
that you would do that. And then also with the turn, cough, and deep breathe. And what this does, what the incentive spirometer does, actually, it helps prevent pneumonia, helps expand your lungs, and help with the carbon dioxide transition in your lungs.
Okay.
And then the turn, cough, and deep breathe, what you would do is you would just turn your head, take a deep breath, and then cough, and that will help relieve you. And you want to do that every 2 hours. That will
Okay.
help relieve you of any sputum or any mucus that is in your lungs and help get that up.
Okay. Sure.
All right. And then, and no abdominal pain or
No.
anything like that?
No.
Okay, perfect. All right. And now I'm just going to listen for your pulse.
Okay.
Okay, so her radial pulse is a +2 bilaterally. I'm going to go ahead and feel for her dorsalis pedis. It's +2 bilaterally. And then posterior tibial is +2 bilaterally. And if I was having any issues or any irregularities with these pulses, I could go to her popliteal, her femoral artery. I already did the radial, her brachial artery, her axillary artery, and then her carotid artery. And I would not bilaterally at the same time check her carotid artery. All right, I'm gonna check for edema.
Okay.
All right, no signs of edema. Sorry. All right, I'm gonna check edema in your legs. All right, and skin color on her legs look normal. Also, the skin color on her abdomen is same throughout the body. No discoloration, no signs of any bulging when I palpated. And all right, perfect. All right, so I'm gonna do your muscular skeletal system, and then also for I also want to do a Braden's assessment, which that has to do with bed sores
Okay.
or pressure sores, making sure there's a prevention of any skin breakdown or anything like that. So the first thing is patient does not have any IVs or any mechanical equipment that I'm worried about her laying on and causing any skin breakdown that way. Do you use any type of walking assistance, any canes, any walkers, or anything like that?
No.
So patient is mobile, which tells me that she's any problems getting up or out of bed.
No.
Okay.
Good.
So that means that she's not going to get any skin tears or friction and shear by being pulled up in the bed or scooting herself up in bed. And then any problem with incontinence, you can make it to the bedroom.
Yes. All right.
Or bathroom, all right, to urinate. And then also, do you sweat a lot?
I feel like I do.
Okay. All right. So that would be the only concern. Just sweating would cause breakdown in areas and stuff too. So that would be a concern if we're looking at skin breakdown. Okay.
Okay.
And then, all right. So and then we would score you accordingly. But all right. So that's that. So we're gonna do the musculoskeletal system, and what we're gonna do first is I'm gonna check your joints, and can you just flex for me? And this is the elbow, and then extend and just come back down. Perfect. All right, and then try pulling up. Okay, pulling. Pushing down. All right, that's a strength of 5. All right, and then go ahead and flex for me. All right, and then extend. All right, perfect. Then try to flex again. Flex. And then extend. All right, and that's a +5 on strength bilaterally for her elbow joint. And then we're going to go ahead and do, and this is actually your forearm. And then I just need you to turn your arm this way, and that is a radial deviation, and then turn this way, and that is ulnar deviation. All right, and then go ahead and try to turn back this way. Okay, +5 on that, and then turn, and then come back this way. All right, perfect. That's a +5 as well. And then same thing with this arm. Yeah. So try to come towards me with your arm. No, I'm sorry. Twist your arm this way. Perfect. That's radial deviation, and then back the other way. That's ulnar deviation. All right, and then try to come back this way. Yeah. And then try to twist back this way. Perfect. That's a +5 as well on strength. All right, and then can you just go ahead and scoot forward for me? All right, and then as far as the neurological exam too, we have what's called a Glasgow Coma Scale, and we check for eye response, verbal response, and motor response.
Okay.
And so you score from a 3 to 15. Anything below 8 is a concern, and 3 you're definitely in a coma, and 8 you're just below 8 you're unconscious, and then anything above that, you have some sort of neurological function, okay? And so you've been looking at me, you've opened your eyes the whole assessment, so you have eye response, you've been speaking to me, you have verbal response, and then we just did motor response, you listen to my commands of moving your legs, okay?
Sure.
All right, now we're gonna do the knee. All right, go ahead and kick your leg out, and that is extension, and pull your leg back, that is flexion, and no signs of crepitus, which is cracking in the knee, in your joint. All right, and go ahead and try to kick out. All right, and then try to pull back. All right, +5 on that, and then same thing, kick out. All right, and then pull back. So that was flexion and extension, and then kick out again. All right, and then pull back. All right, perfect. And +5 as well. And then we're gonna do your ankles, and we are going to. All right, so we are going to. Actually, we're gonna do your feet. Let's do your feet. If you could lift your legs out, sit back a little bit. Yep, perfect. And then go ahead and lift your feet up. No, your toes up. I'm sorry. All right, and that's dorsiflexion, and then down, and that's plantar flexion. All right, and then go ahead and lift your toes up, and then down. All right, perfect. And you can go ahead and stand up for me.
Okay.
All right, and we're just gonna check your balance, and go ahead and I'm gonna hold my hands on you. Go ahead and close your eyes. I'm gonna take my hands off and just stay there. Now I'm just checking for any sorts of movement or loss of balance for about 5 seconds. That looks good. And if you could walk to the wall for me,
Okay.
just normally, and then walk back. Perfect. And if you could do a heel to toe and stay in a straight line.
Okay.
Perfect. No signs of issues with her gait, and she has no signs of balance issues. Okay, perfect. And I'm just trying to think. So, any muscle or joint pain? Okay.
Yeah.
All right, perfect. And then any tingling or numbness? Okay. That would be in your neurological system. All right. And all right, perfect. I think we are about done. So I'm just gonna go ahead and wrap this up. I'm gonna go ahead and put everything in the system for you, and we'll make sure that we get that to the doctor. Any problems or concerns that you need me to put in your notes for you today?
Yeah, I don't think so.
Okay, we're gonna wrap this up. You have a great day.
Thank you. You too.
Bye bye.
Sorry about that.